Epiretinal membrane is basically a age-related growth of an epiretinal membrane, a fine membrane over the macular surface. Causes distortion in vision. It's not a particularly aggressive disease like retinal detachment. There's not a risk of going blind, but it does decrease the quality of vision and can impair reading vision and such. It's a kind of an uncommon problem, in the general population. Because it's not something that's blinding like a detached retina and such, it's not something you necessarily have to, run around and be worried about. Oftentimes, the other eye compensates because it can develop slowly. Sometimes it's associated with a process called vitreous detachment, where there are acute flashes and floaters, which are a normal aging process, and then an epiretinal membrane develops after that. So sometimes people are brought, to pay attention to it and do notice it, especially if it's your dominant eye. You live with it and the slight impairment of vision, or you have surgery to fix it. And our criteria usually is if you don't see well enough to pass a driving test, that would be something that we would consider surgery for. Surgery is relatively, it's a relatively straightforward procedure. It takes about 30 minutes to do. Most people do fine with the surgery. 80 to 90% of people will see better after surgery. The main downside of epiretinal membrane surgery is that if you haven't had cataract surgery, it will accelerate cataract development, and about half the people will need cataract surgery within a couple of years. Cataract surgery is very safe these days, and so it's not an issue. If somebody comes in and has a cataract already, frequently I'll have them go and see about having the cataract removed first, and sometimes that results in improvement in vision enough that they don't need to have the epiretinal membrane surgery. If it impairs your vision, then you should have it done, and you shouldn't be afraid to have it done.